Hello, I'm Dr. Jamal Yousefi, board-certified plastic surgeon. At Younger Image Plastic Surgery Center, we have a holistic approach to liposuction. By holistic, we mean treatment of the whole person, taking into account mental, spiritual, and social factors rather than just the physical appearance. There is an immediate liposuction post-op care as well as the long-term liposuction aftercare. The long-term aftercare answers questions like what foods you should not eat after liposuction, how to tighten skin after liposuction, what exercises you should do after liposuction, and so on. We have certified personal trainers, registered dietitians, nurses, massage therapists, and coordinators that can help you with any of your individual needs. This holistic approach has been very successful for us and our patients, since the results of liposuction can get much better with good aftercares. This short video clip will talk about immediate liposuction aftercare. Things to do on the morning of your surgery. You should plan to have a support person drive you home and have a responsible adult to stay with you at home on the first day and night of your surgery. We do have drivers and support persons for you if you don't have anyone to help you or you like to stay discreet. Put a plastic sheet over your bed and some absorbent towels over it with a pillow for under your knees in order to have everything ready when you get home. No eating and drinking, not even a piece of gum in the morning of your surgery. Clean the nail polish off of one fingernails from each hand. Do not use lotions, foundations, or makeup. Get a shower the night before or in the morning, since you will not be allowed to shower for 2 days. You can sponge bath though. Have some gloves, tapes, gauzes, antibiotic ointments, washcloth, cotton undershirts, Tylenol, Benadryl, and stool softeners ready at home for your aftercare. You can get these supplies from a pharmacy store or purchase them at one of our locations. Make some soup or have some soft diet ready for your supper when you get back. Speaking of foods, what foods to eat? If you had local with sedation, you may resume your usual diet when you get home. With general anesthesia though, you should start with soft and low-fat diet and advance to regular diet by the next day. Drink enough fluids to prevent dehydration. Avoid drinking alcoholic beverages for at least 5 days since you are taking antibiotics and pain medications and they do not match. What kind of physical activities you should not do? Resting is recommended the first few hours after surgery. Obviously, no driving, operating machinery, and making important decisions for as long as you're taking pain medications or have pain. You can start with light physical activity as soon as the next day, especially if it does not involve the area that was liposuctioned. For example, if your abdomen was liposuctioned, you could start by exercising your legs and your arms as soon as 1 week. I recommend you begin with 10% of your normal workout and then increase your activity as tolerated by 10% every day. If the swelling or pain increases, obviously this is a sign to back down or stop the activity. How to wear your compression garments. Right after surgery, we place a compression garment over the liposuctioned area in most cases. After 24 hours, you can remove the garment, sponge bathe yourself, wash and dry the garment, and place the clean garment back on. I recommend wearing the garment most of the times, at least 20 hours a day for the first 2 weeks. After that, you can use the garment for 12 hours on and have it off for 12 hours for the second 2 weeks. If you are experiencing a lot of swelling and inflammation, you may be told to use the garment for a total of 4 to 6 weeks. Most people wear the garment for that long anyways, mainly for support and comfort. How to prevent fainting and feeling dizzy. Some people faint upon sight of blood, and you should anticipate and act accordingly. Some people faint or feel dizzy if they stand up too fast from their bed or even standing up too fast after urination. Make sure to get up very slowly and first sit for a while before standing. Do not lock the bathroom door just in case if you need help to get up and go back to your bed the first couple of days. Some people faint when the garments are removed. Make sure to lie down and then take your garments off and get some help putting it back on for the first couple of days. Let us know if you're feeling dizzy or about to faint, since there might be other reasons for passing out. What to do with drainage and oozing? There is a new technique called open drainage technique, and you should expect a large volume of blood-tinged solution to come out of those small incisions for the first 2 days. The amount of the drainage will be different from your right side and left side. The more area of the body that is liposuctioned, the more fluid will drain. Sometimes the oozing will even run down of your legs. I don't recommend placing a pad or absorbent over the incision under the garment, but you can place them over or outside of the garment so you don't get dimpling or wrinkling of your skin. It is recommended to place a plastic sheet over the bed or chair, then thick large towels over the plastic, and pads or absorbents over your garment. If the garment irritates your skin, you can use a cotton shirt or cloth between your skin and the garment, making sure it is not clearing wrinkling of your skin. When to wash and bathe. No showers for the first 48 hours. You can remove the garment after 24 hours while you're lying down and sponge bath and place the clean garment back on. After 48 hours, you can shower once or twice a day with simple soap or body wash. Pat the incisions gently with a clean towel and place the clean dry garment back on with absorbent or pad over the garment. After the drainage stops, the incisions will close on their own and there is no need for pads or absorbents. Slow drainage may continue for 7 days. Call the office at 703-255-4922 or emergency cases, dial 911. If you notice signs of infection, such as fevers or temperatures of over 101, foul-smelling drainage, localized redness with swelling, and increased pain over treated areas, call the office. If you faint or feel dizzy, you might be getting dehydrated, call the office. If your nausea will not get better, if there is a dramatic increase in pain and swelling, if there is severe itching or rash over your body, or if you have any questions. Things you might experience. Some nausea the first day is normal. Some temperature elevation the first 48 hours. Some inflammation, swelling, and soreness the first 3 days. It could be longer if you have a low threshold for pain. Some bruising, especially if you're more prone to get it. Some itching for the first week, which may be a sign of healing. If it gets worse though, you call the office to make sure it's not an allergic reaction. Some menstrual irregularities for the first month or so, it's normal. It's actually true with any type of surgery, not just liposuction. Things you should not do. Do not soak in bathtubs, jacuzzis, or swimming pools for the first 10 days, or at least until the incisions have healed and closed completely. Do not use aspirin, ibuprofen, Advil, Aleve, Buferin, Anacin, Nuprin, or any other non-steroidal anti-inflammatory medications. They can promote bleeding and bruising for the first week, but make sure to ask your doctor before you stop those medications. Do not apply ice or heating pads on your skin, since it can burn your irritated and numbed skin. Do not use hydrogen peroxide, alcohol, or even plastic band-aids over your incisions. Do not stop your antibiotics on your own. Finish the entire course of your prescriptions. I hope this general liposuction aftercare information answers most of your questions. Remember, these are guidelines and will not take the place of visits and in-person follow-ups. Please call us if anything changes and come for your scheduled follow-ups on time to have a better and easier recovery period. You can sign up for lymphatic drainage with ultrasonic massages to improve the circulation and have a faster and better recovery. You can also meet the certified personal trainers. They actually come to your house, and registered dietitians to get even a better result. Schedule a meeting with our image consultant as well. It makes you feel a lot better when you are wearing the right colors and clothes with your new body.